Welcome to The Explainer. Today, we're diving into a medical breakthrough that is literally erasing the boundary between human biology and machine logic, right inside the operating room. For decades, we've thought of machines and human biology as two totally separate things, right? Especially when it comes to surgery. Well, that boundary, it's about to completely disappear. But think about this. What if the absolute most advanced surgical robots in the world are missing the most fundamental human sense? It's kind of chilling when you think about it. We pour millions of dollars into developing these unbelievably sophisticated machines to perform life-saving operations, and we just assume they're strictly upgrading our capabilities. But actually, in the rush to digitize and mechanize surgery, something deeply profound and entirely human got completely lost along the way.
Okay, let's dive into this. Section 1. The paradox. Precision versus perception.
So this paradox is the core problem that secretly haunted robotic procedures from day one. It's a massive trade-off. On one hand, modern surgical robots give us superhuman precision. We're talking perfectly steady movements, microscopic accuracy, doing incredibly complex stuff through the tiniest little incisions. It's cold, it's clinical, and it's mathematically perfect. But to gain that superhuman steadiness, surgeons had to give up something massive: the human touch. Traditional open surgery relies so much on the warm, tactile feedback a doctor literally feels in their hands. Today's robots, they remove that completely. They force surgeons to rely 100% on what they can see on a screen. Which brings us to Section 2, blinded by sight, when vision fails. Because honestly, what happens when vision just isn't enough? Right now, robotic systems lean heavily on high-def imaging. The surgeon sits at this console, staring at a gorgeous, highly detailed screen, but they have to mentally interpret depth, texture, and tissue resistance using only their eyes. But here's the thing. The human body isn't just seen, it's felt. A blood vessel isn't just a picture of a tube, it has tension. A tumor isn't just a shape on a monitor, it has a very specific stiffness. Healthy tissue actually gives or yields totally differently than damaged tissue. It's like a master pianist feeling the weight of the keys, or a sculptor naturally sensing the density of their clay. In traditional surgery, all that physical feedback flows right into the surgeon's fingertips. But in robotic surgery, they're essentially operating completely numb. Think of it like this. Imagine driving a car on a perfectly smooth road, but the steering wheel is completely disconnected from the wheels. Like, you can see exactly where you're going through the windshield, right? But you cannot feel the road beneath your tires at all. You have no idea if you're hitting a patch of ice or a groove in the pavement. That is exactly the severe limitation and the insanely high cognitive load that surgeons deal with using current tech. They're visually driving, but physically disconnected. But there is a fix coming. Section 3, the haptic solution, fingertips that listen.
We are right at the dawn of a totally new wave of robotic instruments, and these are equipped with sensorized fingertips built to bridge this exact gap. These new robotic fingertips are quite literally designed to listen for tiny physical forces. They measure pressure, so how hard the robot is pushing. They measure resistance, how hard the tissue is pushing back. They can even pick up on incredibly subtle vibrations and micro-deformations of tissue that a human eye could never, ever catch. All of this biological data gets continuously scooped up by the machine and then translated right back into physical signals sent straight to the surgeon's hands at the controls.
It's kind of like, imagine trying to write a letter without being able to feel the pen on the paper. You could probably still do it by just watching the ink appear, but it would feel super clumsy, really slow, and just completely unnatural. Something intuitive is missing. Well, haptic feedback restores that missing layer. It completely reconnects the sense of touch, making the act of operating through a robot feel totally natural and deeply intuitive again. The robot basically becomes a direct translator between the human hand and the biological world. So the crucial point is, this haptic layer fundamentally changes how well a surgery can go. It's not just some luxury comfort feature for the doctor. It is a massive, critical upgrade for patient safety. First off, it drastically reduces the risk of tissue damage. Without touch, it's remarkably easy to accidentally push way too hard. Second, it boosts precision in really complex environments. Think about neurosurgery or cardiovascular procedures where we're talking about fractions of a millimeter. Being able to feel tissue stiffness helps a surgeon easily tell apart two critical structures that might look perfectly identical on a flat screen. And third, it totally lowers the cognitive load. The surgeon no longer has to exhaust their brain trying to translate visual cues into physical intuition. Let's look at what this means for us. Section 4. The invisible safety net. This tech essentially acts as a dynamic, real-time safety layer that directly protects us, the patients. Picture a robotic arm accidentally applying just a tiny bit too much force to a really fragile blood vessel. In the past, that could easily cause a tear. But now, the system provides immediate physical resistance right to the surgeon's hand. The machine literally pushes back. And intuitively, the surgeon instantly adjusts their grip before any damage can even happen. It creates this invisible boundary system that prevents accidental trauma way faster than the conscious brain could ever process a flashing visual warning. It also opens up a totally vital second sensory channel. Let's say you're in a complex surgery that takes, 8 or 10 hours. The surgeon is going to be visually fatigued. They might be stressed. In those absolute clutch moments, haptic vibration alerts and warning signals act as a crucial stabilizer. If the robot encounters an unexpected anatomical density, the hand controls will literally vibrate to alert the doctor. It's this fantastic non-visual backup system that heavily reduces variability and practically guarantees a much higher standard of safety. Now, what's really interesting about this slide is how it shifts our whole perspective. Section 5, from teleoperation to embodiment. We're actually moving way beyond just mechanical hardware specs here and stepping into a profound psychological shift. We're talking about moving from basic teleoperation, where a human just controls a machine from far away, to actual embodiment. Embodiment is this wild neuroscience concept where a tool becomes so fully integrated into our sensory system that it literally feels like a natural extension of our own body. When haptic feedback is perfected, the surgical robot stops feeling like a remote control toy. The delay completely vanishes, the tactile feedback perfectly syncs with the visual feed, and the doctor's brain literally maps the robotic arms as if they were their own physical arms. The machine, for all intents and purposes, becomes part of the surgeon. Now, we actually experience low-stakes embodiment all the time. When you write with a pen or swing a tennis racket or even drive your car, your brain quickly adapts until you literally feel the road through the tires or the ball hitting the racket's sweet spot. But high-stakes embodiment, that is entirely different. We are talking about digitally extending a human body through a multi-million-dollar robotic proxy directly inside another living human being. The gravity and the absolute stakes of this specific type of embodiment are just completely unprecedented in medical history. Of course, getting there isn't perfectly smooth. Section 6. Challenges and the future operating room. In advancement, this monumental definitely doesn't happen overnight. The first massive hurdle we have to clear is latency. For true embodiment to work, the feedback has to be purely instantaneous. Even a millisecond of lag totally breaks the illusion and ruins the physical intuition. Second is calibration. Different tissues need vastly different sensitivity ranges, right? Lung tissue feels incredibly different from bone. Third is standardization, making sure these complex systems work perfectly and consistently across different procedures all over the globe. And finally, the learning curve. Surgeons are going to have to totally adapt their training to master this new hybrid sensory system, because the ultimate goal isn't just slapping a touch sensor onto a robot, it's about perfectly, seamlessly integrating zero-latency touch into a master surgeon's hard-earned intuition. All of this points to a grand new model of surgery, bringing the human body back into the loop, just digitally extended. Think about it. The early days of robotic surgery were all about removing the surgeon from the operating table to prioritize pure, cold machine precision. But this thrilling new era, it's about merging that perfect machine precision with deeply human, tactile perception. We're finally bringing the human being back into the equation. I want to leave you with this incredibly powerful thought from our source material. In the operating rooms of the very near future, a surgeon looking through a console will no longer just say, "I see the tumor." They will say something entirely new, "I can feel it." It absolutely changes the entire paradigm of healing, which leaves us with a fascinating final question to ponder. As this haptic technology advances, just how intimately are humans and machines destined to merge in the future of medicine? Will we eventually reach a point where we literally cannot tell where the doctor ends and the machine begins? Thank you so much for joining me to explore this incredible topic today. Keep learning, keep questioning, and I'll catch you in the next explainer.